It is my great pleasure to welcome our panelists for this session of the program. Today we're going to be hearing from expert speakers with real-world case studies who will explore with us how investments in clean energy and climate resilience are improving air quality, expanding zero-emission transportation, and strengthening community health across Texas. Our expert speakers will highlight how initiatives from these investments are already making an impact in local Texas communities and will share success stories as well. Our hope is that you, our attendees, both in person, those that are attending virtually, will gain valuable takeaway insights on how nurses and other health professionals and environmental activists can support and amplify this progress at the state and community level. So without further ado, it is my great pleasure to introduce you now to our panelists, beginning with Dr. Adelita Cantu, Professor and Interim Director of the PhD program at UT Health School of Nursing. She is passionate about educating future nurses on population health issues, particularly environmental health. She co-edited Environmental Health in Nursing. She is the winner of the 2017 American Journal of Nursing Book of the Year in Environmental Health Award, and has contributed 2 chapters to its 2nd edition. To align with the new essentials for baccalaureate nursing, she introduced a climate change as a public health issue module in the population health class and designed a reflective assignment on its application to prevention. In 2019, she received the Charlotte Brody Award from Healthcare Without Harm. In addition, Dr. Cantu was recently awarded the Presidential Sustained Teaching Award at UT Health. Dr. Cantu's teaching and service have made a lasting impact on community health. Thank you for joining with us. Now it's my pleasure to introduce Dr. Prasanna Jose Baracal. Apologies on my pronunciation. She is a hospital supervisor in the University Health System, a nurse officer on duty at South Texas Veterans Health Care System. She is also adjunct faculty at the University of Texas Health Science Center at San Antonio and Alamo Colleges. She is also an internationally recognized, enthusiastic, motivated, lifelong activist leader with the National Association of Indian Nurses of America and many professional and community organizations as well. She is passionate about empowering people and helping them to achieve their highest potential through advocacy. She is indeed a change agent, a role model, and celebrates the best outcomes for community events and successful goal-oriented performances. She has conducted many professional conferences and shaped nurses to be leaders, as well as has coached and mentored. Dr. Baracal is a fellow of the Alliance of Nurses for Healthy Environments and has motivated and yielded remarkable results through her backyard vegetable gardening and community garden projects. She is the recipient of many leadership awards and continues to make impact through climate change and environmental protection activities. She is also the program manager of the Asian American Native Hawaiian Pacific Islander organization and maintains diversity, equity, inclusion, and belongings at the workplace and in the community. Her charity coordinated activities benefited by international nurses and the public, especially during the pandemic period of COVID. Next, we have Didi Belmares. Didi was born and raised in the city's south side by working class parents. She learned early on from them to practice conservation. Dee Dee is a clean energy advocate with Public Citizen, where she works for a world where renewable energy is used to power our city, and that the people most vulnerable in the climate crisis are protected. And last but certainly not least, we will hear from Douglas Melnick, who was named the City of San Antonio's first Chief Sustainability Officer in March of 2014, and oversaw the development and current implementation of the San Antonio Climate Ready Climate Action and Adaptation Plan, an equity-based plan designed to meet the objectives of the Paris Climate Agreement. He is also leading the development of the EPA-funded Alamo Area Climate Action Plan and leads the City of San Antonio's urban heat island mitigation and climate resilience programs, including the Cool Neighborhoods and Climate Ready Neighborhoods programs. Mr. Melnick also oversees a recently approved 13 MW on-site solar project at 42 municipal sites that will be the largest such installation in Texas and second only to New York City nationally. He has 22 years. He has 22 years of local government experience and previously served as Director of Planning and Sustainability for the City of Albany, New York. Thank you and welcome to our panelists. I'd actually like to now open our panel with the first question to Doug. Doug, can you please discuss with us how the City of San Antonio has taken advantage of the IRA clean energy tax credits and how the related projects benefit the communities?
Great, thank you for the opportunity, and thanks for that question. The Inflation Reduction Act, if we all remember that, was a really good thing, even though now others will tell us otherwise. But it was a once in a lifetime opportunity as a sustainability professional to have the federal government supporting and investing in climate solutions and particularly clean energy. And so we had been working with CPS for many years. We're lucky to have a municipal owned utility, which is very unique. But we were really interested in what could the municipal organization do with our assets. And so we had put out a request for proposal for over 120 city facilities. Let's put it out to the market and said, hey, we've got rooftops, we've got parking lots, we've got parks. What can the private sector, what can the market do? With really the expectation expectation being that it's going to be tough, that the economics really weren't there, and our timing just lucked out, where we were getting responses, and then clean energy tax credits were made available to nonprofits, local governments. So suddenly the economics of our program completely changed, and basically for every dollar we spend on our projects, we get 40 cents back. So this is a project that, again, it's 13 megawatts. We're up to about 54 buildings, municipal buildings, parks. Every corner of the city, every city council district is going to have, these buildings are going to have some on-site solar that's going to reduce the demand on the CPS grid. It's going to reduce anywhere from 50 to 80% of these buildings' loads. So one, it saves money. It's got about a 10-year payback, and then another 10 to 15 years of useful life for those solar panels. So it can generate millions of dollars that will then go back into additional renewable projects or other climate action projects. Improves resiliency. You know, I think we always hear that, well, you know, we've got natural gas in this facility, or we've got a diesel generator. The key to resilience is going to be having multiple contingencies in place. And as we saw during Uri, natural gas is not necessarily the most reliable fuel. So we'll have municipal facilities across the city that have solar. And the next big thing that we're trying to work on right now is we're doing the feasibility of how do we incorporate battery storage in all of these sites. Because again, these are not just city sites, but they can also serve as community hubs during major disruptions. So I think what we're trying to do is look at the city's assets, look at these tax credits that are available that can help facilitate interventions now. They're going to provide direct relief because climate change is here, it's accelerating, planning is great, but we need action.
Thank you. My next question will be to Dee Dee. From the perspective of your own work with Public Citizen, why is it important for the health of our communities to invest in clean energy?
Sure. I have to say that my work isn't standalone with Public Citizen. We work in coalition with other groups, specifically Climate Justice San Antonio. We work with grassroots groups and community-based organizations like Southwest Workers Union. Diana Lopez, who is the director of that organization, will be speaking later on today. Fuerza Unida, the Esperanza Peace and Justice Center. Those are just to name a few of the organizations that we do work with. But it is in doing work with them for these organizations that are on the east side, and specifically for those that are on the southwest side. These investments are so important because what we have invested in the past, whether it's our city or our city-owned utility, CPS Energy, have been toxic facilities like coal plants. We have a coal plant on the southern part of the city, the Spruce Coal Plant, that is the largest emitter of carbon pollution in our city, almost 6 million metric tons every single year. That's on the far south side of San Antonio. Coming in a little further into town are a couple of gas plants. The Milton B gas plants owned by CPS Energy. There are auto and metal recycling facilities that are in these neighborhoods, asphalt facilities that are spewing toxic pollution into our air, to the air that specifically that the neighbors live near. So these investments are so important because we don't want people breathing in that toxic, the toxins that come from gas facilities like sulfur dioxide, particulate matter, and nitrous oxide, or just to name a few, mercury coming from coal plants. And I don't have to tell the medical professionals in this room why those things are bad. But they're especially bad because we have vulnerable people in those neighborhoods. We have senior citizens, we have children, we have people with disabilities, we have those with health issues, and we also have people that are experiencing high levels of poverty. So investing in clean energy would be an investment of taking out those things that are causing respiratory illnesses, for example, out of those neighborhoods. We all want our children to grow up in a healthy home. We want them to be able to, as Anna was saying earlier, that she wants a world where people don't have to stay inside during, when ozone levels are so high, which I believe this whole week we were on, an ozone alert, and we are in ozone non-attainment from the EPA. Our air is healthy to breathe. We don't want that world for our children. I know when I was growing up, I loved being outside. I wanted to play outside. And I wanted my son to be able to do the same thing. And unless we get the things that are, the facilities that are causing climate change, the climate crisis, which is coal plants and gas plants, and replace them with more of what Doug was saying, more of the solar panels on buildings. Let's put them back. Let's put them on people's houses, targeting those areas that have been historically susceptible to the toxic industries. Let's pay them back with something better. So I think that investment would be not only good for our planet, but more importantly for the health of those communities.
Thank you, Didi. My next question goes to Enrita. In your work as a healthcare professional, can you please explain some of how does a city's investments in clean energy directly influence public health outcomes, particularly in light of reducing respiratory illnesses, cardiovascular disease, and other health-related illnesses?
Thank you. Thanks for the question, and good afternoon, everyone. So I'm coming from a nursing framework, and more specifically public health. As a public health nurse for a long period of time, even more so than Anna is talking about her journey. So I see my job in academia as helping to make connections with our students, so that we have nurses that can be prepared to make the connections of things that are happening in the environment to the impact of the patient they're seeing in the hospital or in the clinic, etc. So that's what I see my job as doing, and it's very, very important for our future nurses to understand that clean energy is so important to the sustainability of the community, for the health of the community, by reducing the emissions in the community. By reducing emissions, you're able to go outside and play. You're able to breathe freely on these days where you might have groundable ozone. You won't have to be fearful of being outdoors and then having exacerbations of your conditions. So it's making those connections for students, that it's just not giving someone a pill. It's a broader area, a broader issue of taking care of our environment, because our environment will take care of people. And then making that connection, and then saying how clean energy and our investment in clean energy will help us reduce the emissions, make our community more sustainable, and therefore it's going to trickle down to the patients that you see, or the lack of patients that you see with acute and chronic conditions. So it's making that connection, and part of that connection is how clean energy is so important to enable us as nurses to provide better care for the patients that we care for. So I think that's what's important from the healthcare perspective, is ensuring that we have not only nursing students, but I do this with medical students, public health, with dental students, talking about this, because I want them to make that connection.
Thank you so much. That's a very holistic view of our patients and community members. Prasanna, this next question is for you. With funding restrictions at the federal level, can you please highlight or share some insight into how communities can come together to empower themselves at the local level in spite of large government funding restrictions in a fight for cleaner air? I'm sorry, just as an example of what I'm speaking of, in terms of things like your initiative, like small-scale vegetable farming in backyards or healthcare settings, contributing to cleaner air and healthier climate.
Sure. Good afternoon, everyone. Thank you for the question. All right. I was the past president of San Antonio United Malaria Association, and I'm a fellow of ANHE. So I wanted to do a project for the community, and we have done the vegetable backyard gardening, and we have around 5,000 people in our Indian culture, not the beginnings. Malaria Association. So our members are mostly nurses, and we saw that nurses are stressed out after their work, and we wanted to support a clean air, healthy environment. So I asked everyone to have a vegetable gardening in 1 year of time. We started sharing the seed, and then we encouraged the people to plant, water the plant, and have the vegetable produce, and it was very successful. But the wonderful thing happened is the nurses, mainly our community, the nurses and their friends, came to the hospital and they have a good subject to talk instead of burnout or stress. They started talking about their vegetables, how they cultivated, how much of time as a family they spent outside. So then they had a silent leadership developing, and the children were kind of disciplined, and they learned to put their hand in the soil. Then the children learned the method of planting, and in the hospital and nursing homes and in the community organizations and nursing associations, when they come, they started bringing the vegetables, and they started sharing how they prepared their food, what was the home remedy they had, grandmas when they were back home, how grandma was helping them. So all those talks came, and they had a good relaxed environment. So this became a relaxation method. Then they started including in the hospital nursing home associations during the huddle. They had a subject to talk about wellness programs, and it became wellness program when the nurses thought it is an additional program for them, but naturally it integrated into their daily routine, so they did not feel that it is an added thing to do, became part of their program. Then so many volunteers came back, and they wanted to do vegetables at their backyard. If they didn't have an apartment, they started having small boxes, plastic containers, and they started having one plant and kept at the windowsill. So then they started applying for partnership in the community associated with a non-profit organization. So they found a grant may not be necessary, but connections, friendship, all that is needed. And they even suggested to nursing homes, rehabilitation center at the hospital, they have a micro land, unused lots are there, and really they can use that wasted empty plot to turn into a vegetable garden, and the staff can go and have a mental break, therapeutic break, wellness program over there. So we saw altogether the staff became rejuvenated, emotionally charged, and we saw the retention of the nurses and the community members. There is something to talk about. They were texting each other, then they started talking, making phone calls. Then a society developed. Everybody wants to talk about how did you prepare that tomato, how did you prepare okra, can you share that recipe? So it became like a big vibe, and a social kind of reformation happened. So it's a single effort, one seed, one step became a big vibe, and we had a strong network.
Thank you for that. It really highlights that other dimension of wellness through social cohesion and this kind of intergenerational collaborative approach to health and wellness, and very much in line of what we would really think of as a kind of preventative health in the truest sense of the word. Thank you. Now I'd like to turn my questions back to you, Doug. In addition to the work you are doing within the municipal government, as you're working towards improving resilience in some of our frontline communities, can you please describe the South San Heat Resilience Project?
Great, thank you. One of the things that I think I've learned over the years is there's limitations for what government can accomplish, and I think a lot of times we don't see what's already happening on the ground, despite the city. And so what we tried a couple of years ago was we wanted to undertake a grassroots approach to working with a specific community to sort of co-create a resilience plan. And we have been working with Dee Dee for quite some time, and there was so much going on in the South San area that it seemed like a great place to start. There was already so much momentum going on. So we were able to secure some limited amount in our budget from City Council, brought in a really solid consultant from Austin who's worked with frontline indigenous communities across the country, but basically partnering with Puesa Vida to sort of be our community-based organization lead and owner for this, and had a conversation with the community about what are your climate resilience concerns. We did a quick resilience inventory. Heat became the #1 thing that was identified. And as a part of our budget, we also had some funding for implementation. But the whole point of this was the community was the lead, and we as a city was there to support and help them get to where they want to go. And so the planning process came up with 4 or 5 key areas. There was concerns with providing opportunities for youth, job training, more shade, more heat relief, and as a result of that, we were able to start directing dollars to I think our finance folks are going crazy because I think we have about 10 separate contracts with people within different organizations within the community, but funding was provided to Puerto Unida to provide mini splits to some households that were in extreme need. There was a request where we just need a water fountain in a park along the walking trail. We were able to get that done. We're installing a shade structure in a park. We're partnering with remember who, but basically working on a workforce development training program for folks on tree planting. So, the idea is we traditionally do plans and we labor to get them moving. And then the point of this was how do we do a quick process, have seed funding to start putting into practice, and then creating those connections between organizations and other entities. This is not simply one entity's responsibility. This is, again, it's going to take an entire community to work together to start bringing about these objectives. And I think that's what we're testing. It's going to be a major long-term investment. It's not like just popping in and then popping out. But I think the way we're looking at it is, a 2-year investment, get things up and running. Part of it was one of the other outcomes was they created a cooling committee. They're the ones that are keeping an eye on how this moves forward, and our office continues to be that link to try to help facilitate more resources going towards the community. And I think our hope is reestablishing that program at better budget times, but we should be going neighborhood to neighborhood, particularly starting with those most vulnerable neighborhoods, to start giving immediate relief now. And it's been wildly successful, and I think that our next big task is quantifying impact and then telling the story, so our leaders understand the value in something like this.
Wonderful. The phrase immediately comes to mind, nothing about me without me. And so it sounds like this program is fundamentally based in instead of running towards getting buy-in from the community, you're really having the community investing itself into the growth
Good program. I mean, I think at the end of the day, I think local government, and not all forms of government, we tend to think we're the experts and we know better than others, but if we don't take the time to ask and listen and sort of give up some of that power, we're just going to be stuck in a cycle.
Can I say something to his? Sure. I wanted to say that I really appreciate the work that Doug in Office of Sustainability is doing there on the south side with Puesa Unida. For those of you who don't know who Puesa is, it's an organization that started 30 plus years ago as a very grassroots group that after the Levi Strauss plant closed in the 90s, some women came together to start making clothes to raise funds for families that were laid off from this plant. And so I think it's amazing that this effort started 30 plus years ago by women, by Latinas, by working class families, and it's continuing, and they're just rising up to the next crisis, and that is the climate crisis. And I really do appreciate Doug and the Office of Sustainability for giving them that financial support, but also like saying, okay, what are the solutions that y'all need in your community? It's not about the government saying, we know what's best for you, because they don't live in that neighborhood. So I just want to say, good work over there.
Thanks.
Thank you, Didi. And as it happens, my next question is for you. When we talk about these frontline communities or neighborhoods, can you please break down who we are actually talking about that is really being burdened by these fossil fuels in terms of sharing demographics or commonalities?
Sure. Earlier, I spoke about some gas plants on the south side, the multi gas plants owned by CBS Energy. In that neighborhood, first, let me tell you about the plants. They're called peaking units. They just start up when when the weather is the hottest, right? When demand is the hottest. So they don't run all the time, but when they do run, they are very polluting. Because they don't have the emissions controls that other gas plants have. So in that area surrounding those gas plants, it is 67%, almost 70% Latino. The average household income is around $24,000. When you look at the state average income, it's over $60,000. They are people that have been in the neighborhood for a while, right? So we're looking at a high number of senior citizens, and we also see a lot of children. And so the demographics are very similar to San Antonio, that we have a large majority Hispanic population, but surrounding those toxic facilities, whether it's the gas plants or it's a coal plant further south, they are primarily Latino families that are experiencing high levels of poverty. And there are also people who are experiencing high energy burden, which means energy burden is the amount of household income people spend on their utility bills. And anything over 6% it's a high energy burden. These are people that are having to make decisions between whether they are going to pay their electricity bill, or are they going to buy groceries, or are they going to buy the medication that they need to stay healthy. And those burdens are anywhere from 11 to 17%, depending on the neighborhood. So we're definitely looking at vulnerable people, and there are neighbors.
Thank you for that. And when you talk about that cost of energy burden, I imagine that with the intensity of heat waves and the duration that we've been experiencing and are going to continue to experience, that is absolutely impacting that.
Sure, and these neighbors are living in households in old housing stock, houses built in the 50s and the 40s, so they're not energy efficient. A lot of these houses have only window units, not central AC. And I was talking about one of the projects going on in that neighborhood was to put the mini splits in for people who don't have any air conditioning, right? Can you imagine being in a house that did not have air conditioning when we're experiencing, 90-degree temperatures, and it's actually hotter than that. And then also experiencing extreme cold, like we're experiencing more colder days as well, not just the heat, and that's just as stressful and hard and uncomfortable and unsafe for people.
If I could say something just a little more to describe the population as well. On the south side of San Antonio, there had been only one hospital located in there, which used to be called Southwest General Hospital. It was bought by some equity partners, and I think it was Vista Hospital after that. Well, that community and that population, you got a lot of elderly, a lot of children, and also many of them are working class who are limited in opportunities for employment in that area. So you have to have a reliable means of transportation to go across town to get a fairly good paying job. What's available there are jobs that pay minimum wage or slightly above minimum wage. So anyway, what this hospital found, that they were no longer making profit, so they closed down. And so that part of San Antonio at the current time is without any type of tertiary hospital located there. Now, University Health System, which is our health authority here in Bear County, is building a hospital, but it won't be available until 2028. So right now, there is no tertiary hospital, very limited on primary care clinics in that area as well. So that's just to further give information about the demographics that we're talking about that are not only energy burden, but also are exposed to the emissions that we've been talking about.
So just to very briefly expand on that, if people in that area do need to go to the hospital, I imagine that would be a compounding type of economical burden because now they need to get to. Okay.
So you're looking at an ambulance taking them to the nearest hospital, which University Hospital, again, is our tax-funded county system, but that is a drive. So it would be the ambulance or somebody taking them to the hospital. Most of our hospitals are located in the north part of San Antonio where our major hospitals are. So you, like many cities, you have that hospital core, but again, you have this demographic that's very limited in their access.
Thank you. My next question is for Prasanna. Prasanna, in light of some of the limited resources that we have been discussing associated with these frontline communities, my question for you would be, what role can nurses play in expanding impact of things that they can do in their community, like for your example, backyard farming, backyard gardening and hospital gardening for building community climate resilience? How can nurses really root into that and grow out of that as an example?
Yes, and thank you for the question. Previously I discussed about the self-care and the enthusiasm all the nurses are developing through the individual vegetable backyard gardening. So when they go to the Nurses Association, it is a collective gathering of 50 to more than 100 to 200 nurses, and we have a lot of community gardens available. And I want to say, for example, India Association of San Antonio, they have a community lawn that people came in 1960s, 70s, so they were actually much wiser, and they planted trees, plants, and still we have a community garden. And later, the younger generation came and they don't have much responsibility, little laid back in the community garden. So we actually, in our association, we went to India Association of San Antonio and we saw the garden, and we said, let us do a picnic over there and have bring some food based on our vegetable produce. And we had conducted a picnic over there, and we saw the families working, the children playing, and they went to clear the land, remove the weed, and the garden became very clean. So they have developed a social responsibility, and then they realized what is the benefit of community gardening by doing simple actions. Some of our senior members shared that they have a lot of vegetables and they kept last 2 years. That's more than enough. They are not purchasing any vegetable from the HEB food store, and their communication towards the grocery store is less because they have vegetables, and sometimes they are not using their own car, they are doing the carpooling, so that way they are reducing the carbon emissions. So collectively, when the community garden is there, we have a lot of fresh vegetables, and these fresh vegetables are determinant of our health. And so when we take care of our own health, less need for the medications, less trip to the hospitals, and carbon emission is reduced, and the plants produce a lot of oxygen. So on the whole, our community will be healthy, and the nurses play a lot of big role because nurses are educators. They educate themselves, patients, and whomever they meet in huddles and in association. They talk a lot, and they are a part of sustainable group. And by doing that, they are doing the holistic care. And when they do the holistic care, our community will be improved, their health will be improved.
Thank you so much for that. I think just what resonates from that to me is nursing as being the first point of contact in healthcare. It plays such an important role for us in really valuing, going back to our own roots as nurses and valuing that dimension of health. And that can be, the example of the backyard gardening can be, I think, replicated in other aspects. And not just in nursing, but also in other healthcare settings of other healthcare professionals, looking at the patient in a holistic way. Thank you. Now turning my next question back to Doug. Doug, your office has also been working on providing clean transportation options for low-income residents. Can you just explain a little bit about the low-income e-bike incentive program that's currently underway?
Great, thank you. It's a great program. It's modeled after a program that the city and county of Denver has been running for a few years, and basically we know that again, I think we're still talking about the same populations that have so many challenges: energy burden, health outcomes, and layer on top of that mobility challenges. And so we basically received some funding from Department of Energy a couple of years ago for some transportation initiatives. So the program provides a $1,000 rebate for a income eligible San Antonio resident to go to an e-bike shop that we selected through a procurement process, but basically buy an e-bike. They get an e-bike costs just about $1,000. There's different models if somebody wants to pay the difference, but the $1,000 basically covers that cost. We have about 255 vouchers that we're in the process of giving out. The thing that's so important about it is you think it's such a simple thing, but some of the stories that we've been hearing from folks, there was one gentleman who said this just made his life so much easier. He used to have to take a bus to work and then walk, I think he said 5-6 miles to work. Well, now he's got an e-bike that he can just put on the bus and get there. People having better abilities to get to school, get to work, to get groceries. It's just such a small thing that can transform somebody's life. And when we talk about, we create programs to try to overcome challenges, but sometimes the easiest thing is helping facilitate a small solution. We're not talking about having to provide job training for somebody to get them into a new career, but no, we're going to make your commute easier. So that's the sort of thing that we're really interested in right now is what are those small immediate solutions that we can provide to improve people's lives now with all these other multiple benefits. Yes, it's a carbon-free transportation alternative. That's nice, but at the end of the day, this is about the individual being able to have more mobility.
And can I just ask an extension of my initial question? I don't know that much about e-bikes, but is there a rebate for charging at the charge, like you charge them, right?
So basically, these just plug into a standard outlet. I think it's really, like, the cost is pretty minimal. We originally envisioned this program in partnership with the Housing Authority. It didn't quite work out, but as a part of that proposal, we would have established external e-bike storage that came with charging. So again, this is still a pilot for us. I think once we start hearing from the users that there is an implication around cost, then that'll be something that we'll want to figure out how to mitigate.
Wonderful, wonderful. Thank you so much for that. And now I've reached my last question, and I'd like to give that back to Adelita. Adelita, in what ways is it helpful to frame clean energy initiatives as a health intervention that works to strengthen community support as well as adoption of policy?
Oh, thank you. That's a good question. Especially in these the landscape, the national landscape, state landscape, is how do you talk about these issues? Reduction of emissions, the changing climate, intense weather. And what I have done is, as you said, center it on health, and health being the factor that transcends or goes through all my conversations about it, and not just as a person who wants to do something about the changing climate. I want to do something about the changing climate because it relates to your health, my health, and your future generations, your kids, and the 7 generations ahead of you. So what we're doing right now will have an impact later on to the health of your family, of your community. That's very, very important. So that's one thing. It's just always keep health at the center rather than keeping climate change or the changing climate in the center. So I think that has been a conversation that I'm still developing and still growing, because it's hard. It's sometimes hard. It's sometimes hard to do that. But I find that's the language that transcends everything else. Is how does it impact my health? How does it impact everybody's health? How does it impact my family's health? So I would say that as we do talk, and I know we talked about it with WD and everything else, it comes back to health. I mean, like the program with e-bikes, it makes that individual, so that young man that you were talking about, making his daily transit to work so much easier. If you make his daily transit to work so much easier, he gets there, he's not stressed out, he's more productive. It's less of a strain on his nervous system, on his cortisol release, and much easier to get back home. So it's going to have tremendous impact on health. And all we've done was improve access. So I think centering it around those conversations. And the other thing is those individual stories, like that gentleman. And it's so important to collect stories, because although that story may not be health as we know it, our blood pressure or our glucose, but it actually is health.
I didn't even think about that.
It actually comes down to health. So gathering those stories and then helping people understand how this has a health benefit, then creates those conversations that we can have with our policymakers. Because our policymakers understand health. And if they don't have healthy constituents, they can't, that's constituent, you lose a voter. It's going to impact them. The healthier communities we have, the healthier constituents they have, the happier constituents they have, and that comes to politics as well. And I always have the conversation I'm sorry?
No, keep going.
I always have the conversation and start my public health and my population health with, If we're well, we're all well. If we're well, we're all well. And that's really important. And that's where we can be well in so many different ways, other than preventing a chronic disease. Because it all prevents chronic disease. It prevents those factors that have a negative impact on our health. So I hope I answered that question.
You did,
Yeah.
and what's immediately,
Hey guys.
Keep going.
what immediately comes to mind is really our ability to connect the dots. So, you know, we can't expect our policymakers to understand everything about health. They're certainly not experts at every enterprise that each one of us belongs to, but being able to articulate that in a way that is easy to digest and connect that health piece to that policy piece is absolutely essential for all of us as we advocate.
Yeah. And one more thing I was going to just add to that is that we sometimes find ourselves only thinking about health in the very traditional way where you go into a provider, you get a medication, you go into a hospital. Health is just so much more. The things that contribute to health is so much more. And those are the conversations that we have to have around this whole issue of our changing climate.
Yes, and that actually ties in really well to the reduction in funding, government funding that we're seeing. Because if we have to, you know, we say reimagine, but it's actually going back to the roots of our traditional ideas of what health would be, then we need to really hone in on it at the community, at the family level, to get past these lack of funding that are impacting our healthcare systems and our community infrastructures and support programs. Thank you so much. And so that really was my last question for the panel, but I would like to open it up to our attendees, both virtually and in person. If anyone has a question or even a comment that you'd like to share.
What a surprise.
Let me bring the microphone.
Doug, you meant, is this on? Thank you. Doug, you mentioned that that effort in the southern part of San Antonio, one of the things you found out is they wanted a water fountain in the park. Some research I've done, on a per capita basis, Austin has 3 times the number of public water fountains that San Antonio does. And I think all of you know that as it gets hotter, being able to hydrate is important. In Tyler, Texas, a nonprofit has started providing bottles of water at bus stops in the afternoon because they noticed that workers would go off with their water bottles full of cool water, and then coming home, the water was all gone. I don't know if there's any plans to expand on any of this.
Yeah, so I see 2 things. One, when we did the climate plan back in 2019, access to water came up. You know, basically it was, so but again, it becomes how do we, from a organizational perspective, it hasn't risen up to this huge priority. But now that we have a renewed focus on heat, it's back in play. And at the end of the day, the reality is, I think, getting a water fountain in South San was surprisingly easy for the community, as long as you had an advocate within the city organization. So I think where it spurred us thinking, okay, how do we more effectively identify where that need is, and then make it happen. I think in terms of your comment, just in terms of greater water access, one of the things that's one of our priorities as part of our heat program is engaging with business and institutions, particularly in our target, our priority neighborhoods right now. Who's willing to partner? Who's willing to say, you know what, I will make my facility available for public access. There's, I think, right over on Houston Street, there's right over here, there's, I forget what coffee shop it is, but for a while they were putting a water cooler just out front. Anybody can come, these are simple things, and it's just a matter of starting a conversation with business and institutions, because they may not even realize that there's that need. So I think that's going to be one of our priorities, and at the end of the day, no matter where you are in the city, there should be some place that you can go to at least get water.
If I can, real interesting that you brought up that question. Yesterday in my clinical with my population health students, we were talking about environmental health, and one of the things I always do is take them to the San Antonio Mission Beach and partner with the San Antonio River Authority, and we do a kayak, just a short, out-and-back kayak, just to understand the restoration of that ecosystem that was done and how it's brought back so much of the plant life and the animal life, and how it also is helpful for us to have nice places to go and walk, bike, and we had a student who didn't have water in her water bottle, and she asked me, is there anywhere, and we met at a safety park to start the kayaking, and she asked me, well, is there any water fountain around here? And I had to think, and I said, no, I don't think there is one. And so it's really interesting that you bring that up, because here's this beautiful spot here, but there's no water access. Yeah, so interesting. Yeah.
Thank you. That was actually a really great question, and I just wanted to comment that what I'm hearing is really the importance of community taking care of community, and what that looks like. And in communities like the one where I grew up, that may be going to a house of worship, like a church, where they come together and sometimes can offer resources to community members. That might be the barber shop, where information is more easily disseminated, places where people feel safe to have these kinds of discussions and really brainstorm on what needs to be the next step in the process. But it really does come down to community taking care of community. Please, sir.
Yeah.
This may be an obvious question. You may have answered it. Based on what Dee Dee has done in terms of shed light on a certain part of the community and the toxicity and the health results, are there like mappings of the city that show predominance of major conditions?
Recording in progress.
Diabetes and other issues, because I think both what Dee Dee is saying could also be used from a different perspective too. Like, for instance, what is the incidence of disease and what is the incidence of health, and where are the healthiest people and what's happening, as well as. But I think that would be a very good basis of information. Is it available? Is it? Do we have that?
I guess I can start with in terms of where do we know the healthiest people are and people that aren't experienced. One thing we always look at is life expectancy. And there's differences certainly in San Antonio as there are throughout the country in terms of just looking at life expectancy by zip codes. And so the area that Dee Dee is talking about, the south side and then the west side, are some of the lower life expectancies that we have here in San Antonio, where the areas out in the Stone Oak, Alamo Heights, those zip codes, you're going to see a longer life expectancy. So if you look at that as a indicator of who is the healthiest, who enjoys better health, and so you look at life expectancy, and so that map does, then you can overlay that with people that have the most diabetes, the most issues of hypertension, chronic hypertension, other chronic diseases as well. And in fact, Bear County, I was just explaining it to the students today, Bear County leads all of Texas in terms of counties on lower leg amputations due to diabetes. So, and that you overlay it to, you see where most of the diabetes here is in San Antonio and Bear County. And then I guess the top of that, if you will, it tracks with the areas that historically have been redlined in San Antonio. So the near west side, the south side, and Doug can speak more about the heat maps that you do have. And those are also overlying those same issues. So that
Yeah.
you can pick up on that.
And then, thank you. Yeah, we had done some work with UTSA, you might be probably aware of it already, but where we wanted to, we know all of San Antonio is hot, but it's more complex than that. And so working with researchers, looking at surface temperatures, but then folding in the city's equity atlas that takes into consideration race and income and other socioeconomic criteria. And as Adelita mentioned, yeah, it's basically, it lines up with traditional redlining. And I think you could take any socioeconomic issue and more than likely it's going to fall into one of those neighborhoods.
Is the equity access, what did you say?
Equity atlas?
Atlas, is that online?
So it was.
It was.
There, and that's an offline conversation. I think there's a lot of. No. I think a lot of this was in response to federal and state pressure, and so I think, but we.
The whole truth.
But it's but we still have it.
Yeah.
If you guys need anything, just let us know.
And with that too, I mean, yes, that
Is no longer available, but on the website like it was. I just discovered this a couple of weeks ago because I was trying to look for it as well, and I just couldn't find it. I figured, okay, it's probably been taken down. And sure enough, that's happened. But again, it's not necessarily a surprise. I mean, this is historical legacy in San Antonio in terms of who is the most vulnerable based on multiple factors. But because of the, like on the northwest side, lack of trees, more concrete, and everything that contributes to more heat. And so that's why you see in many of this city organization, Parks and Recs, giving away trees and helping to plant the trees, etc. I was got some funding from the Office of State Berkeley a couple of years ago on just a small project I did with a youth organization on the near west side, and I had somebody from UTSA who's an architect. He's Dr. Hashimi. I don't know if you know Dr. Hashimi, and he actually showed us a picture of a building in Milan that was created or was built with trees on the side. So it's an apartment complex and it's all just trees also on the side of it. And it was like, oh my God, we are so far behind.
Well, I'm glad you said that, because for me, that's like the big takeaway is the tools are there. I think we've been doing this for so long, and we always hear, well, we can't, or the technology's not there, or it's too expensive. None of that's true. I think it's just, it's political will and it's prioritization, and we know it's going to get hotter and hotter. How do we deploy the solutions now? And Bill, talk your ear up on that.
yeah.
If you look around the world, it's hot everywhere. Last year was the hottest temperature that our world has ever seen. And it's not just San Antonio, it's all over the world. And fortunately we have Google now, and you can start looking around and see what's going on in other places. And you're absolutely right, Doug. I mean, there's lots of stuff, pardon the pun, cool stuff going on around the world that we could have here if we had the political will, yes.
My questions,
in regard to your initiative on the south side. And have you worked at all with like decentralization of energy production, like small scale solar?
Yeah. So I'm glad you asked that, because that was one of the things I wanted to pipe in earlier. I mean, when we look at sort of like the big H, around health, in my mind, one of the number one things is continuity of energy, right? I mean, if there's a significant disruption in the grid, all right, well, it's what does indoor temperatures look like, whether it's summer or winter? People on dialysis, like it's a big deal, and the solution to that is, microgrids. Like, I feel like we should start building these decentralized renewable energy systems, neighborhood by neighborhood, with storage, to ensure that things stay on. And a lot of cities have been working on this concept of resilient hubs, which is, it's a physical location, which is great. But, what happens when the power goes out? People can't go get money from ATMs. They can't charge their phones. Gas pumps don't work. Supermarkets, like, we need to start thinking from a community system scale and make sure that there's redundant power to keep it going. Because otherwise, all the planning in the world isn't going to provide immediate relief.
Well, we experienced it with Uri.
Yeah.
Yeah.
And again, with Uri, I mean, the thing, the University of New York at Buffalo did a post-Winter Storm Uri survey of our community. And the disparities based upon economics are very, very clear. I mean, none of it's surprising, but for folks in poverty, one of their number one issues was they lost food, and they didn't have money to replace it. Well, solution is maybe we need centralized locations in neighborhoods that are on some sort of backup power where people can store. So there's solutions to all of this, but until we really acknowledge what's happening at the household level, we're just going to be spinning and putting band-aids on everything.
Thank you. Oh, sorry.
Oh, hi, my name is Ebony. I'm with the Texas Nurses Association, and I was gonna say I talk loud now. I'm able to check. One of my biggest challenges I find that in the work that I'm doing with the Nurses Association is that nurses, particularly our nurses that at the bedside, and even if you're transitioning away from the bedside, academia, wherever you're going, may be disempowered into getting involved into advocacy efforts. And when we're thinking about climate and we're thinking about advocating for clean energy, it's hard to feel like you can get involved if you don't feel like an expert. So how can we get nurses that may not know all the things involved in advocacy and policy influencing around clean energy, and how do we get to basically raise our policy literacy, surrounding these issues to nurses that may not be as engaged right now?
I think that's an ANHE question.
I love that question. This program itself was being co-hosted by the Physicians for Social Responsibility Texas chapter and the national, actually global organization, the Alliance of Nurses for Healthy Environments. So this organization, my organization, ANHE, has been around 15, I think 16 years now, and there is a wealth of information about environmental issues, policy, advocacy. We do Hill Days, and it is all free to join, and it is online. And we have forums that support the different aspects of clinical practice and research, global health nursing in the frame of climate change, and policy and advocacy. So all that to say, there are resources available to you. ANHE is the major nursing resource. We're leading the way, but organizations can lean into that. We can lean into each other and give that expertise, share that expertise with each other. So ANHE is a wonderful resource, and we even have an e-textbook that has been used in academia, and many of our nurses are both in clinical practice and in research as well. So I would offer that as a great starting point, and that's a totally unbiased opinion. I was a volunteer before I ever worked for ANHE, but it really is a super source of information and support.
I was going to add one thing as well. I think too, one of the things nurses that are working at the bedside are doing multiple things. I mean, they're working at the bedside, they're working full-time jobs, they're going home, they have kids, and advocacy doesn't necessarily come to the front of their mind. And I think we in the nursing profession need to do a better job in, if you want to say, growing our own. Like I think the nursing schools, and I try to do that in my classes, but I wish we had more targeted training, more targeted education as nursing students about the issue of advocacy and how important the voice of nursing is. Because, and Anna Several was saying, nursing is the time and time, year after year, the most trusted profession. And we don't do enough in leveraging that in the way we communicate, not only to our patients, but to our community, and a part we can play in it. So if there's anything that TNA can do in terms of lobbying that something like that is included in nursing curriculum, I think that would be really helpful. And that way you kind of grow your own instead of like myself just getting into it after I start practicing. But I think that's that is one way, is really putting this as part of the curriculum. Because tomorrow, just for instance, we're doing a poverty simulation with first-year medical students. And we just started putting that into the curriculum, but giving them a basis to understand people in poverty and how that influences the choices they make about, do I pay my bill or do I buy this medication? So I think the more we can include those in, the better off we'll have with these professionals that are coming into the practice.
And I just want to thank you so much, Anita. I also want to say that oftentimes when I'm speaking at nursing conferences or associations, one thing that always comes back is the question, how does this look to me at point of care? What does all of this that you're talking about, climate change and greenhouse, how does that look to me at point of care? And so I think it's really important, when I'm speaking to a group or educating, to break it down. Not just giving the umbrella view, the high level view, but really break it down to the elements that's meaningful for that clinician. And so what that might look like is connecting the dots between something like factors of climate change, and one of what that looks like in extreme weather events. Maybe that looks like extreme heat and more patients coming into the ER suffering from heat stroke or what have you. Maybe that looks like more wildfires and having communities that are impacted by that wildfire smoke, miles and miles away. I live in New York, and for the first time in my long life, I am now experiencing the smoke that's happening in Canada. I've never even been to Canada, but I've got their smoke. And so what that looks like are people with chronic respiratory conditions having those symptoms aggravated. So I tell my nurses, we need to expand our nursing assessment and begin to assess and address those symptoms that we know are connected to the environment and how they're being triggered. And I always say every nurse that I've ever known is a specialist in her unit. So I come from oncology. I'm an oncology nurse practitioner. And I can tell you that when I worked on the floor, I knew my unit. I knew the supplies in the supply closet. Now, looking back, I could have vocalized what needs to be a single-use product and what doesn't necessarily have to be. And we know much more about that now. So I encourage every nurse, whatever setting you work in, whether it's home care, oncology, wherever that is, begin to look at your surroundings and begin to question how things could be different, and then look for the allies in leadership that are willing, and not everybody is your ally. Not every ear is willing to receive what you're trying to say. Look for the allies that are in line and want to hear more, and begin to build that out between your peers, and that procurement is within the hospital setting. That's the lion's share of what contributes to healthcare's carbon footprint. And so the supply chain is a very significant aspect of healthcare facilities and how they are contributing to climate change through their carbon footprint. Nurses can absolutely have a voice in that.
I have one more question that ties into what I've asked. And, we're planning a coalition building summit in our district, so we're not working in silos and duplicating our efforts as far as it goes for advocacy and policy influence. And what I found in the work that I've been doing is that we are siloed, and communication channels between organizations that have common and shared interests are not very good. How can we improve this flow of communication between organizations that have shared legislative priorities so that we can advocate together, we can optimize our advocacy efforts? Loaded question, right?
Yeah, very good question.
Loaded question, and I think Doug, you and Dee, you have the experience of partnering. But I think one of the things that I have seen with the silo is that we have to give up what sometimes we think is our territory. We have to stop being territorial. We all share the earth. We all share the air we breathe. We all share the ground in which our food is grown. And we have the responsibility of breaking down those barriers so that the communication is easier. And that's one thing. The second thing is, and I found that this has helped in my public life work, is that you never know who you're going to meet and how you might be able to partner. So I'm always taking cards, and okay, maybe I can get my students over there and we can partner with something. So being open to breaking down those silos and just open to understanding different perspectives, I think is important. But that's what I've seen through my years, is just that sometimes we tend to be territorial. Yeah.
I think I mentioned earlier that I belong to a coalition called Climate Justice San Antonio, and we're just ordinary folks trying to, stop using fossil fuels, here in San Antonio. I met, and I believe that I met you in 2018, because she was in a previous coalition that was working on the climate plan, and I don't know how you came to that coalition, but I can say that we always say, when we look at our groups, we're like, okay, we have housing folks, we have people who work on housing, and we have people who are working on this, and we really could use a health professional in our group. and because we always come to Adelita when we want that, health expert. But don't be surprised if you approach the organization or you approach the coalition and said, I'm a nurse. I'm sorry, did you say you were a nurse? Or?
I am.
You were a nurse, that's what I thought. And I'm a nurse, I'm really interested in this work. I guarantee you they're going to welcome you with open arms. And they absolutely will, because we live in a world of skeptics right now, right? We live in a country that is in very much denial about climate change, right? Despite the science behind it. And then there are also people who are, like in denial about COVID too, despite the science behind the COVID, the COVID. But we really, I think, where we strengthen our work is deferring to the experts. And I do consider nurses experts as well, because you all are on the, at the bedside, right? You see the impact of whatever somebody's coming in to the hospital for. We defer to the scientists, or so I would say if you're willing to take that extra step and approach some groups and introduce yourself, I'd be happy to see you. I would, if you came to me and said, Didi, I'm in San Antonio now, I want to come to one of your coalition meetings, I'd say, come on. So yeah, good luck there.
Right here. Oh, I'm so sorry.
Hi, my name is Isabel Martinez. I am also a registered nurse, and I'm also the president of the National Association of Hispanic Nurses, the local chapter here in San Antonio. And thank you for our panelists, and every single one of your testimonies was very inspiring to me and brought up a lot of questions about myself as well too, and my community. I also am from San Antonio, born and raised. I'm first in my family to go to college and earn a degree and, experience the differences. Most of my mother's family lives on the west side. My dad's family lives near downtown area and grew up around this area as well too. I was just telling Prasanna, my mother-in-law used to live, I forgot the name of the building, but she lived a couple of blocks away from here in one of the senior apartments that's, by, San Antonio Housing Authority. I forget what it's called now, but it used to be Saha, now it's something else. But she passed away a couple of years ago with dementia and that was the biggest complication, was the dementia piece. But, I see the struggle of, my family, the patients I take care of, and just putting all the dots together. And so today really brought a whole lot of thoughts in my head as well too. I guess that's also a philosopher. I have a PhD in nursing. I think about things as well and contemplate and ponder, well, how could I make a difference? I came today as part of Hispanic Nurses Association. We also received a grant this year for climate change that we earned from the national part of the National Association of Hispanic Nurses. And how can we use that to help our community? And so one of our activities that we did do was we purchased cooling towels and passed them out at one of our community events that we participated in. But what really brought to my brain today was, how could I bring one of y'all, and actually I talked to Dr. Duncan before we were talking about, she approached me and said, hey, can I come to one of y'all's meetings so we could talk about the PhD program? And I'm like, yes. Now I'm thinking, how can I bring one of you guys over and we can talk about climate change and healthy environments in our community? Because I know, our community of Hispanic nurses want to help the community. And the community here in San Antonio is mostly Hispanic. And that just resonates with our culture, our family, and how we can make a difference for our future. And just thinking about San Antonio, how it's grown. The folks that live near downtown, unless you're in Alamo Heights, people are moving out. They're moving further and further out, and the communities in the inner city are struggling. And so it is a big difference. And I think it would be very fruitful. And I wrote down in my notes, I was like, well, how can we connect and improve that advocacy in our community? And I know the National Association of Hispanic Nurses can definitely help make a difference. And so this is an invitation. Who wants to come? Yes, I love it.
Thank you. And I just wanted to say, you talked about it was your mother-in-law that recent question. There is some evidence about the link between climate change and our changing climate and cognitive decline. So that there is some evidence there, and so I think the more people are aware of the connection, and I think that's one of the things we could probably all help with is helping the nurses understand the link so that they can help their communities understand the link as well.
Yes, absolutely. And as a matter of fact, there's something coming up with the Alzheimer's Association. There's a bill coming up. Oh gosh, I'm gonna have to look at my emails real quick, but there's something coming up with Alzheimer's Association and dementia that's coming up that we're from national, that we've been pushed through Hispanic Nurse Association with, influence our members to vote on November the 4th, because it's some research that we want to push through so that they can do more studies on dementia and Alzheimer's. So yeah, definitely lots of connections there. And pulling the data to make a strong statement is always helpful.
And Dr. Martinez, I also wanted to just let you know from the National Association of Hispanic Nurses, I'm on the Policy and Advocacy Committee, and I can tell you that with the Health Policy Summit coming up, we are going to have an environmental, that's one of our themes, and we are having an environmental speaker. So this is definitely from the national to the local, becoming incorporated, and this is a brilliant, rooms like this where we are in person and online and participating are wonderful ways to make those connections and get those conversations. And this is how it's done. When you ask, well, how do I do this? Just like this. So thank you.
Thank you. Yes, I'm looking forward to that. I was able to participate in that this last February and heard the presentation from Dr. Roxana Chicas, hence the idea for the cooling towel around the neck. But she did some awesome work in Florida. She did a research study on farm workers and the temperatures outside. And, it's just really amazing. So really I got that idea, we got the idea to, implement that piece of putting the cooling towel around the neck, because she was talking to us about, the results of her study, and they wore vests that were too heavy. They didn't want to wear that in the farm. And so something a lot smaller and cooler was so much easier to put around their neck and keep them cool.
Any other questions or comments?